I'm Cassandra, and I work with ThedaCare. I'm also a busy mom of 3. Doing it all is more challenging than ever, and that includes making healthcare decisions. So, welcome to Real Talk, where we cut through the confusion, chat with experts, and help you get the care you need for you and your family. When joint pain takes over, it can stop you from doing the things you love. Here to walk us through some care options is ThedaCare orthopedic surgeon, Dr. David Liebelt. Welcome, Dr. Liebelt. Thanks for being with us.
Thanks for having me.
All right, our first question. The CDC says 1 in 5 people are living with pain, and that increases as you get older. So tell us what you typically see with patients.
Yeah, a common reason for patients to visit their healthcare provider is musculoskeletal pain. And as an orthopedic surgeon who specializes in hip and knee reconstruction, I see patients constantly that are suffering from hip or knee pain. That is a pretty normal thing that happens with aging. Anywhere where 2 bones meet, those bones are usually coated with cartilage. That cartilage tends to wear out over time. And as that wears out, your body responds with increased inflammation, heat, pain, stiffness. There's a lot of things we can do to treat that.
Okay. Now, a lot of people probably know someone who has had some kind of joint replacement, but some people just might not know what it is. So can you talk a little bit about that?
So if your pain really is stemming from that cartilage wearing out, a surgical solution would be to remove the cartilage. And if we remove the cartilage, we need to replace it with something. So joint replacements are based on the premise of removing cartilage that's worn or diseased and replacing it with metal, plastic, ceramic, artificial things that are shaped like the cartilage was when it was healthy.
So how do you know when it's right to see your regular physician or somebody who's a bit more specialized?
Sure. Well, I think if you're just starting to experience pain or suffer an injury, it's reasonable to see a physician you have a relationship with. Your primary care provider might realize that that problem could be better served by seeing a specialist. What's a specialist? For example, within orthopedic surgery, I only focus on hip and knee reconstruction. And that specialty, dealing with the same problem every single day, makes me more apt to deal with that problem correctly.
Okay, so that's really good to know. You kind of start with your primary care provider, and then from there, they can help direct you to the right place.
Sure.
All right, really good information for us to start as we jump into this topic. Now that we know a little bit more about replacement, we're going to dive a little deeper into some questions that probably a lot of patients come to you and really start the discussion before they consider joint replacement. So I think the first question we want to start with is, how much downtime would someone potentially have with a joint replacement?
So a knee or a hip replacement generally takes an hour and a half in the operating room. Patients will have that surgery early in the morning or middle of the day. Within hours after surgery, they're up and walking, moving around. So many surgeries today are ambulatory, which means the patient can go home the same day of surgery. For patients who don't go home the same day of surgery, it's a very short hospital stay. They're usually going home the next day or a day after. The downtime is after surgery, you're suffering from pain and swelling from the surgery. So you need to spend some time resting, some time elevating, some time treating that pain. But then you quickly begin physical therapy. You're getting back your range of motion, you're getting your strength. I would say within 2 to 3 weeks, you require no assistive device, you're back to driving, you're getting yourself to your physician's appointments. Somewhere around 6 weeks, you're back to many of your activities, although you're still getting better week by week. Most surgeons like to think that after 3 months, you're significantly better than you were when you started, and you can keep improving for up to a year or 2 after surgery.
This sounds a lot different than I think a lot of people probably think of joint replacement, right? Because before, years ago, it was that long recovery time, right? Like you needed to plan this and plan for a long recovery, right?
Historically, the surgeries were more invasive, involved more pain. We had less options for treating that pain, and surgeons were more careful, given the limited amount of results we had, in mobilizing patients quickly. Now we have multiple modal treatments for pain. We mobilize patients faster, and generally patients spend very little time in the hospital.
That's great. So what kind of support does someone need if they are recovering?
I think it's helpful if you have family or friends that can support you at home. People usually leave the hospital with an assistive device like a walker or crutches. You need to spend some time resting in bed and elevating. The reason you chose to have surgery is you're suffering from hip or knee pain. As you leave the hospital, you're a person with hip or knee pain. You're trading a problem that was painful but not getting better for a surgical recovery that involves pain, but you're consistently getting better.
That's good information to have. So there's a lot of care options here at this new center, and it's really designed to have everything in one place. How does that benefit the patient?
I think going to one location for diagnosis, treatment, and recovery is very helpful. It's not fun to bounce around between your physical therapy location, your surgeon's office location, where you had surgery, and where you recover from surgery. So here at the ThedaCare's Orthopedic Spine and Pain Center, you can be seen by a non-operative physician who may help you diagnose and treat your problem without surgery. You can then be referred to a surgeon who might diagnose and treat your problem surgically. During that process, you'd work with physical therapy, which is here in the building. If you chose to have surgery, you may go home the same day after a short recovery period with therapists, or you might stay the night, in which case we have an inpatient facility here. All of that under one roof with orthopedic surgeons, orthopedic physicians, pain management physicians, and spine surgeons all working together.
That's really good for the patient. All right, really good information if you are considering joint replacement, those questions that a lot of people might be wondering. Dr. Liebelt, you perform robotic-assisted surgeries with a device called ROSA. So we wanted to get to know a little bit more about this equipment and technology. So our first question, what is robotic-assisted surgery and what type of benefits does it offer?
Sure. So orthopedic surgery that involves replacing hips or knees has always been based on removing diseased cartilage and bone and replacing it with metal and plastic. Well, the removal part is supposed to be precise, and so we use instruments to help us make accurate cuts, removing the diseased tissue from the body. Robotic assistance has allowed us to make more informed cuts. The analogy I like using when I'm telling patients about robotic assisted surgery is a carpenter. So a carpenter could have a pencil and a tape measure and build a very excellent cabinet. Nowadays, carpenters are using lasers and more advanced measuring devices to accomplish the same task. A great cabinet is a great cabinet, but the better the tools the carpenter has, the better work they can do.
That's a really good analogy. I think that helps a lot of people understand how that actually helps you. So who's a candidate for robotic-assisted surgery? Can anybody have that as an option?
Anyone can be considered. Robotic-assisted surgery is dependent on imaging, preoperative imaging, and using that to use the robot to help the surgeon decide where to cut. It's a discussion to have with the surgeon after looking at your preoperative imaging that has indicated your surgery.
All right, very good. Thank you for explaining robotic-assisted surgery that we do hear so much about. A lot of patients are wondering about it.
Anytime.
We've heard from Dr. Liebelt. Now it's time to hear from Rosa herself. Rosa, thank you for being with us.
Thank you for having me.
All right, our first question, Rosa, how do you help surgeons?
I offer precision and accuracy through a special feature designed to ensure proper alignment in real time.
Okay, do you actually do the surgery?
No. I was designed by surgeons, for surgeons, as an accurate and efficient surgical assistant that also produces data.
Okay. What do you do for fun, Rosa?
I am a very right-brained individual. I enjoy analyzing data, quantifying results, and helping patients and surgeons. I also enjoy making music.
Okay, Rosa, that is incredible. So, can you play one of your songs for us?
I would love to.
All right, music to some people, I guess. People have a lot of questions and some fear about joint replacement. So to learn a little bit more, we're going to play Myth versus Fact with Dr. Liebelt here. First one, joint replacements don't last a long time.
I would say that's a myth. We never know how long a joint replacement will last in an individual patient. There are no guarantees when doing surgery on a patient. However, we have been performing hip and knee replacements for over 50 years, and so there's a lot of data to look back. And in multiple studies, both for knee arthroplasty and hip arthroplasty, if you look at patients 20, 30, 35, 40 years after surgery, a significant number of patients are still functioning without pain and without having had a revision surgery.
Oh, okay. Orthopedic surgeons will discuss all care options, not just surgery.
I would say fact. Surgeons want to meet a patient and want to know why they're there. So what kind of pain are you experiencing? What kind of disruption in your lifestyle has that caused? Oftentimes the safest and easiest treatment for a problem is not surgery. And I don't think any surgeon wants to recommend surgery if a problem can be solved without it.
Okay. When recovering from joint replacement surgery, it's best to spend a lot of time in bed.
I would say myth. After surgery, it is important to rest and recuperate from surgery and also control swelling, which often means spending time in bed and elevating your lower extremity. However, you want to get the joint moving, you want to get to therapy, you want to see your surgeon, and even hours after surgery, you're moving around in the surgery center or the hospital. And so I would say myth.
Okay. People can resume many of their physical activities after a joint replacement.
Fact. The whole reason we're doing the joint replacement is to get you back to the lifestyle that you felt you couldn't accomplish with the pain and dysfunction you had in your old joint.
Okay. And last one here, avoid joint replacement surgery if you're too young or too old.
Absolutely 100% a myth. Again, you should see a surgeon or an orthopedic provider if you are suffering from pain, stiffness, joint dysfunction that is disrupting your lifestyle. Traumatic injuries in the young can lead to joints that look like an older person's joint. And with good medical optimization and careful surgical care, even the oldest patients that are suffering from joint pain can be treated.
Okay, really great information. And there you have it, Fact versus Myth with Dr. Lebo. Dr. Lebo, thanks so much for being with us. You've answered a lot of important questions. And if you want some more information about joint replacement, call the experts at ThedaCare. Thanks for watching Health Inspired Real Talk.
At ThedaCare, our mission is to help you live your unique best life. And we want to know what kind of questions you have when it comes to your health care. Leave your questions and comments below. And be sure to like and subscribe so you see the very latest in this series.